vast majority of people are exposed because of a building that has been water damaged. So it could be from an external source like a flood, it could be from a plumbing leak. But if a house gets damaged with water, mold starts to grow within 48 hours. So it's really common for mold to flourish, and it can be hidden behind drywall, behind in an area where you can't see it. Hi, it's Dr. Connie Casebolt here at Forum Health Greenville, and I'm here today to talk about something that I have to confess I knew almost nothing about 10 plus years ago. So in my conventional medical training, I heard the word mold and I heard the word mycotoxin, and that was it. I heard nothing more about what symptoms it could cause and how to remediate it. So now we're finding that there are so many unexplained symptoms that are due in fact to mycotoxins, which is the toxins from mold, getting stored up in your body. Here's the problem. 25% of people have great difficulty in getting rid of mold toxins, whereas the other 75% are fine. So you could have a group of people living in the same house or working in the same office building. 75% are fine, even if they're being exposed, and the other 25% can have symptoms. So what kind of symptoms are we talking about? First of all, if it's unexplained or unusual, you need to think mold. I know you can't see this sheet. I'm going to read off some of these symptoms. Fatigue, weakness, muscle aches and cramps, headaches, chronic sinus congestion, abdominal pain, nausea, diarrhea, any kind of unusual pain, especially if you have a terrible pain right here, that is often mold. Sensitivity to bright lights, joint pain with morning stiffness, brain fog, a lot of people concerned about that, numbness and tingling, metallic taste in the mouth, excessive thirst, dizziness, even heavy periods. These can all be due to mold. So if you suspect that you have that, I highly suggest that you come in and take our mold test. It is the first urine of the morning. We have you mail it off, and then we get the results back in a couple of weeks. And if we do find mold, we have a very effective protocol to help your body detox permanently from mold so that you can feel better. Part of our mold practice is to make sure your house is thoroughly evaluated by an expert so that we can make sure that you're no longer having ongoing exposure. So that concludes our little talk on mold. Again, if you have these unusual symptoms, don't ignore them. We can probably find the root cause.
Hi, Dr. Saxena here, Chief Medical Officer at Forum Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.